Hi, this is Dr. Fry. I'm going to be going over with you today a new piece of equipment that we just got into the office. It's called a PEMF. It stands for Pulsed Electric Magnetic Frequency. And the purpose of this mainly is to provide cellular energetics. What I mean by that is there's a tremendous amount of research, actually since the 1950s and 60s, but really a tremendous amount of research in the last 20 years. 30 years, on the idea that our cells are the smallest living functional unit. And the cell, we can draw a picture of a cell here. Inside the cell we have all these little things called organelles. So inside of our body we have organs, inside of our cell we have organelles. But the cell itself actually needs a charge. And we're going to see like a little lightning bolt. That's supposed to be a lightning bolt, okay? So there's the charge that has to hit the cell. And just because you can't see this electricity or this electromagnetic charge that the cell needs, it's real. And a great example that I joke around is take a butter knife and stick it into your socket. It's real. You can feel it and it's real, even though you can't see electricity. It's the same thing with your cell. Now, what you also want to know is we get these charges from the sun in what's called solar frequencies, and then from the earth we get geomagnetic frequencies and Schumann frequencies. So we're getting a charge coming to our cells from the earth that we need. And what we basically found is over a time frame when we sent astronauts into outer space, they came back with all types of problems because the Earth's geomagnetic charge, or the PEMF, was gone. And over a time frame what we found is, as you measure the charge, going back as far as Dr. Otto Warburg, who won a Nobel Prize, by the way, for his research, there was a connection between cellular voltage and health. And 70 millivolts is healthy. 60 millivolts, your health is diminishing. 40 millivolts, we start seeing chronic illness. And cancerous process starts at 20 millivolts. So what you want a good charge, and you want that charge as close and up near 70 millivolts as possible. And over a time frame, what we found is that this charge that comes from us, to us from the earth, we also give out to people around us. It's an energetic field that gets put out to us. And it extends about 15 feet, it's been measured. So what you want to know is that you need this charge to come in, and this charge allows our cells to work properly or not. Over a time frame, our body requires 4 things, actually 5. Food, water, sunlight, fresh air, and the Earth's PEMF to have good cellular energy. Without energy, nothing can work. Energy is the most basic thing that the cell requires. The number one most common chemical in our body is ATP, which is energy. Number 2 are methyl groups. But back to the idea of cellular energetics. We need this, and over a time frame, what we found is if we can help this, we can dramatically raise the cellular energetics up more near that 70 millivolts. And when we do that, our health immediately follows. So in the past, I've talked about that we do 4 things for people: brain-based care, lifestyle modifications, food changes, and nutrients required based off a scientific blood test. I'm now adding in a 5th component called cellular energetics. And the cellular energetics can be done by a specific machine. So what we need is cellular energetics. Where you want to be is by about 70 millivolts. So this is health, okay? 20 millivolts is where we see disease and we see cancer type process take place. So you want to be up over here. And over a time frame, what we found is, and I've been reading this for a long time, all of the high voltage that were around, from electricity to Wi-Fi, to microwaves, to TVs, to computers, to electricity, to towers, a whole host of areas, is now starting to mess with our ability to stay healthy, because it lowers your cellular energetics. It lowers the microvoltage of your cell. Power lines, electric blankets, hair dryers, water beds, refrigerators, electric clocks, televisions, computers, compact fluorescent lights, other household appliances, microwave ovens, mobile cell phones, cell phone towers, cordless phones, mobile cellular phones, masts, towers, transmitters, electric smart meters, wireless networks, Bluetooth devices, computers, cordless baby alarms. So basically, over a time frame, there's harmful ELF, extremely low frequencies, that lower your cellular energetics. And over a time frame, these can really, really, really lower your body's ability to work and heal. There's been research, and there's over 10,000, listen to that number, 10,000 scientific papers written on PEMF. Now, why are you not seeing this all over the United States? Well, just like everything else. If it's not a common procedure, if insurance may or may not cover it, we don't see it very much. Most doctors base any equipment that they buy on one question: will I get reimbursed by the insurance company for this? I've never done that. So in my office, you'll notice there's some really, really high-level, scientific, innovative piece of equipment. They cost me hundreds of thousands of dollars to get some of this equipment. And the reason why I have it is because I actually read the research. And I believe that if it's a good piece of equipment, if it's scientific, if there's no major side effects to it, if it's non-invasive, and it has major healing capacity, if it can help restore the innate recuperative healing power of the body, I'm going to bring it in. And then I'm going to go to you as the patient and say, this is what I think. This piece of equipment can be a major player for you in helping you restore your health. Most people, 98% of them, say, thank you, Dr. Frawley, for bringing this piece of equipment in. So I invest in it after I research it, and I make sure that it's going to be a good piece of equipment that's going to help. So back to the idea of what it does. It raises your cellular energetics. It raises the electricity of the cell. It's been shown to help with pain relief by increasing endorphins. It increases energy via increasing ATP levels. Now let me tell you what that means. It means better energy of the cell, which means better energy to you, which means better healing, which means higher levels of health. There's a lot of research that when we start to lose our ability to make energy, our ATP, that over a time frame we can start to have cancerous cells, because the mitochondria in the cell that produces energy gets tired and can't work, and it signals back to the genes that it's breaking down. So if we can increase ATP levels, we can help with that process also. There's also brain, nerve, and tissue regeneration, improved immunity, better oxygenation and circulation, better sleep, and increased human growth hormone. This is anti-aging. Human growth hormone is one of the most studied hormones, and basically what we know is that if you have higher levels of human growth hormone, you're actually younger, because as we age, that goes down. Relaxation and stress reduction. It's massive what you'll see when you get this PEMF treatment, because your cellular energetics goes up, the voltage of the cell goes up, and your stress and relaxation, stress goes down, relaxation goes up. You build stronger bones, less chance of osteoporosis and bone fractures and hip fractures, and there's better prostate and or bladder function. So there's been measurements of up to 500% increase in your cellular energetics after using a high-level PEMF machine. It maintains the function of every individual cell at an optimal level every day, and it's an important part of slowing aging. Now, you can't say there's no such thing as anti-aging, but what you can do is raise the cellular energetics, make the body work better, and age at a normal process. What I see is most everyone is prematurely aging. The PEMF unit that I bought is There's different levels. You can buy little home units for $200-300. I'm spending close to $80,000 on these units, and the purpose of this is because it's the best unit out there. I've done a lot of research on it. I've spoken to my colleagues. I've spoken to the top 2 or 3 manufacturers. This is the Mercedes-Benz on the market. You'll notice again the piece of equipment that I buy, I only buy the best pieces of equipment. I research them out. But it really, 8 to 10 minutes on this will make a dramatic improvement in raising your electricity and the microvoltage of your cell and raising your cellular energetics, which allows you to work at a higher level, heal at a higher level, have better energy, normal aging, prevent premature aging, and get the body to heal itself. It improves muscle function, increases circulation, decreases inflammation, it decreases stress, heals fractured bones, increases oxygen in your body, and basically some of the other actions include reducing muscle tension, improved tissue healing, increasing energy, improving clotting factors, which means less strokes, slowing the development of arthritis, stimulating the immune system, helping the body to detoxify, improving the uptake of nutrients, reducing blood pressure, helping nerve function, brain function, heart function, liver function, balancing the acupuncture meridians, improving sleep, and making soft tissues more flexible. And again, there's over 10,000 scientific papers written on this. We're going to be putting together a packet of information. If you'd like that, please let us know. But I hope you're excited about the possibilities of this, because I'm very excited about this. This is brand new in my office for the year 2017. But I see it's going to be a major improvement in helping chronic sick patients in every aspect that we can by going after our physiology, going after those gears, and making the whole system work better. If you have any questions, let me know. We look forward to helping you along the way.